Do you ever wonder how tiny needles can provide big relief for muscle pain and tension? Dry needling is a powerful treatment technique that I regularly use in my practice, but it's probably the least understood by my patients. In this video, we'll dive into the science behind dry needling, exploring how it works, what it feels like, and why it's becoming a go-to therapy for pain relief and recovery. People often assume that dry needling is just some form of acupuncture, but that's kind of like saying that a mechanic and a plumber are doing the same thing just because they both use wrenches. The same tool can be used to accomplish different goals depending on how you use it. I've been using this technique on my patients for nearly a decade, and I can honestly say that it has been a game changer for my practice. Of course, it's not appropriate for every situation, but when it is, the results can be remarkable. I need to start this discussion by first explaining what dry needling isn't, because we've been trying to fix ourselves by sticking needles in each other for millennia. The most recognized practice is acupuncture, and that is just one of many procedures provided by someone trained in traditional Chinese medicine. This practice is founded on the idea that our bodies have a vital energy force called qi, and that qi flows across specific channels or meridians. If the qi is balanced, then a person will have spiritual, emotional, and physical health. But when the qi isn't balanced, disease can occur. Traditional Chinese medicine says that there are more than 2,000 specific points that are linked through the various meridians, and the insertion of a needle into one of these points will improve the flow of blocked or stagnant qi. Now, I consider myself to be an evidence-based practitioner, and I don't believe that the available body of research strongly supports its use as a first-line treatment strategy. But that doesn't mean I think it's complete hogwash. I really do think that acupuncture can be beneficial for treating many things, but it is fundamentally different from the more modern practice of dry needling. And even though it might look similar to acupuncture, it was developed completely outside the confines of traditional Chinese medicine. So we started injecting painkillers to treat muscle pain pretty much as soon as the hypodermic needle was invented in 1844. But in 1941, doctors Ernest Brav and Henry Sigmund published a study that showed muscle pain could be treated by just inserting the needle without injecting any medication. This finding had come on the heels of another discovery: the existence of trigger points. Trigger points are hyper-irritable spots in a muscle that can refer their pain to a distant location. These dense nodules within the muscle belly can easily be felt, and they cause a disproportionate amount of pain relative to the amount of pressure that's applied. The pain referral patterns that they cause are remarkably consistent across the entire population. But what's interesting is that they don't really line up with our dermatomes or myotomes, which are the maps for the sensory and motor pathways that go from the spinal cord out to the rest of the body. Despite the early research into this area, it didn't really gain momentum for another few decades. In 1974, doctors Janet Travell and David Simons began systematically mapping these referral patterns, and in 1983, they published the first edition of Myofascial Pain and Dysfunction, the Trigger Point Manual. After 3 revisions and 2 subsequent volumes, these books still stand as the definitive guide for any healthcare provider who treats myofascial pain. These books were also critical for dry needling's wider acceptance because they finally gave us a good working theory for why it works. The trigger point hypothesis starts with a taut band inside a muscle that develops due to tissue overload or trauma. This increased tension suppresses the enzyme that breaks down acetylcholine, which is a neurotransmitter that initiates a muscle contraction. With a bunch of this signaling molecule just floating around, the muscle band will be in a state of constant contraction. That tightness restricts blood flow to the area, and less blood flow means less energy supply. At the same time, that ongoing contraction still requires energy, and this leads to an imbalance. This imbalance is known as the energy crisis theory, and it's thought to cause a release of other inflammatory markers that then go on to stimulate our pain receptors. When a needle is inserted into a trigger point, it mechanically disrupts those dysfunctional muscle fibers, and that leads to a cascade of physiological responses. The most notable is increased circulation to the area. More blood flow means more oxygen and more nutrients. It also helps remove those waste products and reduce inflammation. Studies have also shown that dry needling stimulates the release of that enzyme that breaks down acetylcholine, allowing it to finally relax. Now, even though the concept of trigger points was established in the medical literature back in the 1960s, and dry needling was gaining ground, the standard of care for treating myofascial pain still involved injecting anesthetics into the muscle. But in the 1970s, China began opening up to the world, and there was a huge surge of interest into acupuncture. Dr. Chan Gun was a US-based physician who caught this bug in 1974 and, over the next few years, developed his radiculopathic model. He noticed that most cases of chronic musculoskeletal pain were complicated by either compression or damage to a spinal nerve. So he hypothesized that when neural impulses are restricted, the muscles supplied by that nerve become hypersensitive, leading to muscle shortening, pain, and trigger points. He believed that the nerve root was the source of the pathology, so he concluded that treatments required addressing both the affected muscles and the muscles around the spinal level that innervate it. He called this approach to dry needling intramuscular manual therapy, and it's still widely practiced today. But since the early 2000s, studies have continued to unravel more and more of how our bodies respond to dry needling. This wider focus really forced us to take a more nuanced view of what's actually happening, and most practitioners credit its benefits to the neurophysiological theory. This theory seeks to identify any possible mechanisms that could be at play. It holds space for the fact that our bodies are unbelievably complex, and that any observed benefits are likely multifactorial. I've already talked about how it can increase blood flow and stimulate the release of neurotransmitters, but the small trauma of a needle will also activate the immune system, and stimulating sensory receptors promotes the release of endogenous opioids, which are your body's own natural painkillers. We can even notice changes in muscle activation patterns and coordination, which suggests that dry needling can also make changes to the central nervous system. So far, I've only talked about how dry needling can help with restrictions in the muscles, but it's also effective for treating many other conditions. Dry needling can also help with breaking up scar tissue. Inserting a needle stimulates the release of fibroblasts that are responsible for producing collagen and repairing tissue. And it also encourages the existing collagen bundles to realign into less of a knotted mess. For those same reasons, it's also very effective in treating tendinitis. What's more, dry needling can also help with spasticity caused by neurological disorders like strokes, and that can help decrease pain and increase range of motion. We are finding new ways to integrate and expand the use of dry needling at a pretty remarkable pace. On average, there are 3 to 4 journal articles published every week, so I'm really excited about the future and its potential to treat even more conditions. The next generation of modern dry needling is currently being written, but it's important to remember that it should be part of a multimodal treatment plan and not just used as a standalone treatment. I always tell my patients that the worst thing they can do after a session is absolutely nothing. Dry needling creates a unique opportunity to reset the muscle and reinforce that mind-body connection. Most of the strength gains I see with my patients just come from plugging the muscle back into the brain. So it's pretty important to follow it up with a corrective exercise that will help cement any new movement patterns. Just remember, this definitely isn't for everyone, especially if you have a fear of needles or a blood clotting disorder. But if you think it might help, then you should absolutely ask your physical therapist if it's something they can do for you. Thanks for joining me today, and I'm Steven the PT Doc. I hope this helped.